Some people who develop late-stage Alzheimer or dementia will lose their ability to swallow or eat. Now, in the hospitals in Thailand, the doctors would recommend to put in a nose tube feeding and nasogastric tube. Now, when I asked the doctor what happened, because definitely for Alzheimer patients, they will attempt to pull the tube out, which is very true. The doctors all recommend hand restraint. Now, when we talk about hand restraint, maybe the image that comes to your mind is tying the poor patient on the bed with both hands on each side of the railing, and then the patient is going to cry and beg for mercy in a very pitiful way because they cannot move their hands, or they may grow very aggressive because they are being tied. No, that is not the case if you are able to find a comfortable hand restraint. I wish to say that initially that was my concern too when I have to place my mother who have end-stage Alzheimer to tube feeding. But we were very fortunate. We managed to find and purchase a special hand mitten from one of the main pharmacy supplier in Bangkok, who sell this mitten, which is very special, which is shown in the picture here. As you can see, this mitten, it is made of soft material and it is unyielding because there's a layer of plastic film covering beneath the cloth, and then there is netting. Hence, there's ventilation and the hands would not be hot or heaty, and the person would not feel uncomfortable. So we tie at the wrist, and we have to secure it securely at the wrist because they will try to actually remove the mitten. Surprisingly, for Alzheimer patients, they are very smart. Most Alzheimer patients were very intelligent people before they develop this onset of this illness. So you can see that sometimes that intelligence remain in the way they try to get the mitten out. They will land their butt on it, and then they try to push the hand out, or they will try to step on the mitten, and then they pull their wrist out. So you tie it tightly, and it's not painful to the wrist. This is because for this mitten, we have 2 pairs, and my mother has worn it for 3 months. This is a game changer. That's why this product is only sold in Thailand at the moment. So many people are not aware that it is possible that such a product exists, and if you have a good hand protection and a hand restraint mitten for the person, then they won't struggle so much they won't be attempting to pull out the tube because their hands are not free. Because for Alzheimer patients, if you don't cover their hands, they will pull out the tube. Even if you restrain using a hand restraint, you strap their wrist to the bed railing, which is a bit inhumane, I would say. And with their hands exposed, they are very smart. They will find a way when nobody is looking. They will try to wiggle their body towards their hands, and then they will move their hands further up so that they are able to touch the nose, and they will pull out the tube. I have seen my mother attempt to do this before, numerous times in the hospital. So that's why the nurses eventually put the covered hand mitten for her, and that's where I was aware that there is one, but that was from the hospital, was the kind of homemade one. Because you see, Thailand is the form of treatment for end-stage Alzheimer is to have a nose tube, and because of Alzheimer patients, you cannot prevent them from pulling out the tube, so they have hand restraint. They have proper hand restraints in place. It is not considered unethical. It's considered unethical if you don't let them eat and let them starve to death. They view it as is a very sad if that is being done to the person. So with the mitten, initially when I wear for my mother, initially she was not used to it, but she didn't have a kind of aggressive reaction towards it, because in her stage of Alzheimer, you see, when a person develops swallowing issue, they are already at end stage of Alzheimer. So she already cannot differentiate certain things. And when we put on the mittens, she is not aware that it's a restraint. To her, it's just that why her hand looks a bit different. So as long as the mitten is comfortable, there's ventilation, and you just take it out once a day to wash her hands with soap and water, and then put back and change the mitten wash it every 4 or 5 days with another set. So it would do already. Because of that, we could keep the nose tube in place. And also another important factor is, of course, the securing of the nose tube with the tape. We have to learn to secure the tape properly, because even though they have the mitten, they will use it to rub on their nose. They will try to rub it off. So you need to change the tape often when the oil on the face or sweat loosen up the tape that is securing it. Nowadays, after about 3 months, I do not need to restrain my mother's hand on the bed railing anymore. She just put on the mitten the whole day. In fact, nowadays, when I changed her nose tape for her, I don't have to restrain her. Last time she would struggle, or when I do suction, phlegm suction for her, I don't have to restrain her anymore, tie her mitten to the bed. Her hands is actually just covered with the mitten, and it's like a normal hand where she can move around, except that it's just covered. So this mitten is really, very good. The person I have actually spoken to the person who came out with this product. I'm not sure if it's available elsewhere. He said, no, this is his own design, and he came up with this design because when he saw the patients, he feel very sorry for the patients, and he would like to come up with something comfortable for them. And he has done some improvisation over the years on this product. So it is only available from him, but he can actually, since he can converse and write in English, I will put a link to his Facebook page and also relevant links that he have, as well as a post I have written on the usage of the hand restraint for the Alzheimer patients who are on tube feeding. So I hope this video helps. Of course, if we do the normal restraint, we tie them up with their hands stuck on the bed railing without much ease of movement. It's very difficult because then they will be bed bound, and there's also a danger of developing bed sores, and they may become aggressive. So when you put on a comfortable mitten and you observe them, and we take care that make sure that the nose tape is quite secure, then they will eventually get used to it. And eventually also they would kind of like get used to the nose tube. This is what my mother's friend who told me, because my mother's friend, they were all nurses, former nurses, so she had actually taken care of a bedridden patient. So she told me that eventually, after a while, their mucus secretion will grow lesser, and also they will get less irritated by the tube, the nose tube, and they will get used to it. So if we didn't even if we straight away think that we don't let nature take its course and we stop the feeding, it is very sad, because I would say that most of the time it's only the swallowing that is affected. That's what the doctors say too. Most of the time they are still able to, their body digestion system works perfectly fine. They are still able to absorb nutrients from the food. They are able to absorb water and fluids into and actually secrete them. Just the swallowing cannot work. So if we can take care of that problem, and we can find a way to prevent them from pulling out the tube, then we can actually help them and prevent and keep them alive. and prevent them from suffering from dehydration and lack of nutrition. Thank you.